Good morning, my name is Juan Caro Codón. I'm a consultant from Hospital University of Paz, and we are going to discuss extended ECG monitoring in patients with hypertrophic cardiomyopathy. Well, the TEMPO-HCM study is in fact a call for new research regarding extended ECG in this group of patients, because what we have learned from this study is that non-sustained VTs are absolutely prevalent among this population, and this raises questions regarding its true ability to discriminate high risk from low risk patients regarding sudden cardiac death. And we also think that it's very important because there is a signal here that perhaps is a useful technique to screen for atrial fibrillation in these patients. We are conducting a prospective observational multicenter registry, including patients with a diagnosis of hypertrophic cardiomyopathy, and we aim for a low-risk cohort, so we are excluding patients with an already implanted ICD, and what we do is to use a dedicated device for ECG monitoring for 30 days, and we compare the rate of clinically relevant arrhythmias during 30 days versus the first 24 hours. And what we have found is that the detected incidence of significant arrhythmias is much higher with extended ECG monitoring than with 24 hours monitoring. The findings is that there are absolutely more arrhythmias using extended ECG monitoring. That difference was highly significant, and it was mainly driven by a shockingly high prevalence of non-sustained VTs in the low-risk patients with hypertrophic cardiomyopathy during extended ECG monitoring. I think that we should start considering extended ECG monitoring in patients with hypertrophic cardiomyopathy in order to adequately screen for atrial fibrillation, and that we should be very careful when some patients show us in their device some episode of non-sustained VT. We should be very careful to adopt clinical decisions with that information. We should encourage research in this area. The next obvious steps are to include more patients in our registry. We are trying to aim for a large cohort, and we are expecting to continue the follow-up and to report clinical outcomes from these patients, which I think they will be very, very interesting.